Well, uncontrolled hypertension is a massive problem in our patients, and renal denervation is a non-pharmaceutical treatment option for these patients, which bears the hope to actually make a difference. Although the HTN-3 trial was negative, there's actually quite encouraging new data out now with 3 recent trials. One is the Simplicity HTN on and off med data, and the other one is the Radiance HTN solo data, and all of these 3 studies showed a significant blood pressure reduction as compared to sham. Yes, I mean these 3 studies, they have quite similarities in terms of study design, but they do differ in terms of the technology and also technique which is used for the procedure, for the renal denervation itself. There's ultrasound and there's radiofrequency, and with radiofrequency there are 2 different approaches. Either you deliver ablations only to the main renal artery, or you add the branch renal arteries as well. And we wanted to do first head-to-head comparison of these different technologies and techniques to find potentially the ideal procedural technique. So that was a 3-arm study, as said, a single-blinded, single-arm. Our primary endpoint was blood pressure reduction on ABPM at 3 months. And we found that irrespective of technology and technique used in all 3 groups, we had a significant reduction in blood pressures at 3 months. But when we looked at the group differences, we found that ultrasound denervation led to a significantly more enhanced blood pressure reduction as compared to radiofrequency in the main renal artery only. And then the other group, radiofrequency with ablations delivered to main and branches, that was in between with no statistical significance. I think it's a little bit early. What is really important to mention is that the latest data on radiofrequency technique showed that the blood pressure reduction is more enhanced after 6 months. We looked at our data at 3 months, so it's very important to do the same analysis after 6 months. And we had 120 patients, but this is still small numbers for a 3-arm study, so I think we need to redo that and to confirm the results in a larger trial, more patients, and certainly multi-center. At this point in time, it's certainly too early to recommend one technology or approach over the other. I think it is back. Maybe the most important finding of our study is that irrespective of technology and technique, it is once again in support of the overall principle that with this technique and procedure you can reduce blood pressure, and that at least I'm very optimistic.